Hello again. Over the past few videos we've spoken about how physical activity is fabulous for our health, but are there any reasons to avoid it? Well, people are often nervous about starting physical activity because of a worry about injuring themselves or about worsening injuries that they already have. And whilst injuries can obviously happen, they're not very common, and they do tend to happen in people who are very physically competitive, playing elite sports, or doing exercise which is at a high level. For most people, injury is not a massive risk. Here's a little table that we can have a look at. As we can see, pain is the number one cause of anxiety, and worry about making conditions worse is up there too. This is understandable, as we don't want to make our lives worse while trying to make them better. Experts in the field have looked into this and produced an agreed statement on whether things were risky. They suggest that activity is safe, even for people with multiple medical conditions. Clearly the type of activity might need to be changed depending on what people are able to do, but the risks are very low. However, although the risks are low, that's not how people feel. If you feel that activity might be harmful for you, then please do discuss it with us, because we wouldn't want you to miss out on something as beneficial as physical activity. It's not just about saying move more either. You and we need to make sure that people with potential problems are not doing the wrong things or doing too much. Otherwise, confidence disappears and we stop doing the activity. Everyone has their own starting point. Clearly, this is going to be different for different people. For example, if someone has heart disease or is confined to a chair, they may need to start with something easier that's going to cause less problems for their joints, etc., than someone who's already experienced with physical activity. Remember that you must stop and talk to a doctor if things are getting worse, more breathlessness, chest pain, palpitations or dizziness. Let's talk a little bit about intensity as well. How intense should our activity be? We need to tailor it to our starting point, clearly. In a previous video we mentioned that seated exercises were possible, things that could be done in a chair. For people who are fairly healthy, we can just tailor it to how we're feeling at the time. As mentioned here, moderate intensity means that you can talk but not sing. I know that feeling. This is going to be different for different people. So for someone just starting out, it might not take too much effort for them to get to this level, whereas someone who's been exercising for years might be able to do much more and still be able to talk. It's not a competition. We should all do what we're comfortable with. And don't feel downhearted or that you have to go all out right at the beginning of taking up a new activity. It's okay to start slow and easy, and you'll still be getting the health benefits. What about aches and pains? Well, activity can sometimes leave us aching, but we should see this as a positive. Those aches are a symbol and a signal that our body is responding to the activity that we're doing and that we're getting stronger and healthier. And they won't last long. And also, the more activity you do, the fewer aches and pains you're going to get. So if you want to live longer, look better, feel better, then start doing some physical activity. Will it help your memory? I forget. But it's fantastic, so start today.